If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
On the website, OutbreakNewsToday.com, we report frequently on sexually transmitted infections, or STIs, on the local, the state, and the national level, and international. Syphilis has been in the news frequently, and the numbers continue to seem to increase, in some cases at alarming rates, in various states and in various countries. For example, in North Carolina, they recently reported a 40% increase in syphilis. And Las Vegas reported an increase of 128% since 2012. Nationally, syphilis has increased 15% from 2013 to 2014. And like I said, it's not just in the U.S. A lot of other countries are having the same issues, including Canada, New Zealand, Germany, and England. And I just did a report this week in Ireland. They're seeing an increase in syphilis. So, joining me now to discuss the syphilis situation is Fred Wyand. Fred is the Director of Communications for the American Sexual Health Association, National Cervical Cancer Coalition. Hello, Fred, and welcome to the program.
Well, hi. Thanks for having me. I'm glad to be here.
Excellent. I'm glad to have you here. All right, Fred, let's go ahead and start. Can you give us a little primer on syphilis? Let's start with, what's the causative agent of syphilis?
Treponema pallidum is the name of the organism that causes syphilis, and it's a bacterium, so it causes a bacterial infection of syphilis, which is treated with antibiotics, principally penicillin.
Right. Okay, and how is syphilis spread?
It's transmitted during vaginal, anal, and even oral sex when direct contact is made with a syphilitic sore or lesion. These are called chancre sores. So basically through close sexual contact, that is the principal way. Some other ways, it's possible for a pregnant woman with syphilis to transmit it to her baby if she's not treated. Treatment with penicillin is highly effective, almost 100% in stopping transmission to the baby, so that's why these cases are especially sad, because they're totally preventable.
Sure. Now, syphilis is a pretty complicated disease, and it's divided into several stages, and which can go on for many, many years. Can you tell my audience a little bit about each stage of syphilis?
Sure. Yeah, you're absolutely right. So starting with what's just called, appropriately enough, the primary stage, and that's usually marked by the appearance of a single chancre sore that develops at the site of infection, wherever the organism entered the body. There can be more than one sore, but usually it's just the one. The sore usually develops in a few days or a few weeks following infection, but it could take 2 or 3 months. There's a good bit of variability there. There's typically not a lot happening at this stage. The sore itself might be kind of firm, roundish in shape, probably won't hurt or really be painful. The sore can last 3 to 6 weeks on average, and it'll go away even without treatment, which can create kind of a false sense of security. But if it's not treated, and even though the symptoms are clear on their own, the infection then progresses to the secondary stage. And at that point, it's marked with some more complex symptomology. Things you might see, stuff like a rough kind of reddish-brown rash on the palms of the hands or on the soles of the feet. Normally doesn't itch or do much of anything. There could be rashes really elsewhere in the body, the torso, the neck. Those are some common areas. You might see things like syphilitic warts. These are like moist and kind of elevated skin lesions, usually in the anal or genital area. even some stuff like a patchy loss of hair on the head, and just a general sense of yuckiness, kind of like an ill health or malaise. That's pretty common. Secondary stage symptoms can occur pretty quick. 2 or 3 weeks after infection, but they might take as long as 6 months. And as with the primary stage, these symptoms will go away even if the person is untreated. And when those primary and secondary stage symptoms start to clear away, you enter what's called the latent or hidden stage. And this is when there aren't any signs of the disease after those couple of stages. So no symptoms are exhibited, but the syphilis is still present. And this latent stage can stretch out a long time, many, many years, even decades, potentially. During this part of latency, transmission is probably not likely. You never say never. It's probably not likely because you're just simply not having the lesions, the syphilitic sores on the surface of the skin, which really is the main vehicle of transmission. So a person enters this stage, it goes on and on. Let's say they don't get treated, they were never tested. They can enter eventually what's called the late or sometimes tertiary stage. And this can happen many years later, anywhere from 2 years up to 20 or 30 years. And here is where the problems, if they're going to happen, typically start. Really some of the more major health considerations. A common issue here are agumas, like small tumors that start developing on the skin or the bones or even some other organs, and they can damage the skin and the bones. There might be some cardiovascular problems. There can be neurological issues. Neurological issues can really happen at any stage, but with the late stage, you might be talking about things like paralysis and dementia, even potentially death. So there can be a really long, complex arc with syphilis.
Yeah, and you went ahead and you already said that penicillin is the treatment of choice. And diagnosis nowadays is pretty simple, but back in the day, they even gave syphilis the nickname the Great Pretender because it appeared like so many other things. Briefly, without getting too scientific, how is syphilis diagnosed?
Most of the time, blood tests are used to diagnose syphilis, and there are two types here. Remember back when you asked about the causative organism, I said it's Treponema pallidum. Well, the first test is called a non-treponemal test, and these are tests that look for antibodies that you'd expect to find with syphilis, but they aren't really specific to syphilis, as they can develop due to some other conditions, like some autoimmune conditions, for example, can do it. These tests are fairly inexpensive, but since they aren't specific to syphilis, if you have positive results, you'll need a confirmatory test, and those are the treponemal test. And these tests find antibodies that are specific to syphilis. These specific antibodies remain detectable pretty much for life, as opposed to the nonspecific types that non-treponemal tests find, which usually disappear at some point after treatment. So each test has its role, and both are typically used to diagnose syphilis. And that's for most people. That is what their doctor or their nurse would want to do.
Very good.
There's some other tests, too.
Mm-hmm.
There's one where a sample is taken directly from a sore that's suspicious for syphilis, and it's examined under a special microscope to actually detect the organism. That's called a dark field exam.
Right.
Sometimes there's a cerebrospinal fluid test involving the brain and the spinal cord. That's often helpful when checking for neurosyphilis.
Okay, now, Fred, the CDC reported in the year 2000 and 2001 the national rate of reported primary and secondary syphilis cases were about 2.1 per 100,000 population. And they say that was the lowest rate since reporting began in 1941. However, times have changed, and it's increased almost every year since. And the latest numbers from 2014 say there was about 20,000 cases reported, the most in a couple decades. So as an expert in sexually transmitted diseases, what's changed? Why are the numbers increasing so much?
I don't think we fully understand what's causing these increases. CDC does a lot to look at this, and I know they're trying to understand those specific issues and challenges within many different populations, because you're talking about a very diverse population. I mean, there probably is not a single universal reason you can point to and say, that's it. But some thoughts. It's clear that state and local STD programs, including those that provide direct hands-on care like testing and treatment, have been under budget pressures, and many of these programs have been scaled back and or they're passing along increasing costs to their clients. And of course, a lot of these programs are the ones that serve some of the most at-risk populations, the poor, young people, sexual minorities, and so on. So that's almost certainly a factor. Something else, I think in some ways all of us maybe underestimate syphilis. I know that when I first started, I thought of syphilis as something that was, back in the 30s.
Right.
That was, I didn't really think of it in the modern day so much. And so we pay a lot of attention around other STIs, and I don't know if we really focus on syphilis as we should be. So engaging patients and providers both to make sure that they understand the importance of thinking about syphilis and also dealing with the lack of comfort we all tend to have around sexual health topics. I mean, the awkwardness about sexual health and sex in general can inhibit our clinical encounters, really from both the patient and the provider side.
Now, in 2014, when I said there was 20,000 cases in the country, the CDC says that 83% of the reported male patients were men that have sex with men, gay and bisexual men. And I've noticed, I've been reporting on this for some time, that a lot of health departments and departments, ministries of health in other countries are pointing to apps. There's apps out there like Tinder and Grinder as a reason why we may be seeing higher numbers. Do you know of any evidence that there's a link to the increase between these apps and syphilis?
I asked one of our medical advisors that question, and his response was that we don't have the data to know for sure. So I don't believe we can say for certain. I mean, that is, I know people mention that frequently, and you see lots of news stories about it. I don't know that we can really say it for sure. And I'm sorry not to give you a better answer on that, but I think that's really kind of where we are.
No, that's fine. I mean,
but I would say there's some other stuff we can look at too, especially when you're talking about men who have sex with men, MSM. I mean, they do, as you mentioned, they suffer a disproportionate burden of syphilis, and I think there are issues that hamper access to care and drive some of the negative outcomes. Beyond simply being able to procure and pay for care, there's stigma, there's homophobia, a lot of cultural barriers. I mean, healthcare providers are not always well-versed in the needs of LGBT patients, gay, lesbian, bisexual, transgender patients, and there's almost certainly going to be lack of comfort with both patients and providers, and I think things like that can really hamper these clinical visits. I think another thing that I hear some of my colleagues talking about is the potential for prevention fatigue, especially these days when we have effective treatment regimens for HIV, where it's no longer the death sentence it once was. So, maybe the guard drops a bit. Maybe there's less condom use. Maybe we're not as worried about sexual health. And perhaps educators and healthcare providers themselves don't have the same sense of urgency to engage and test and be proactive. So that's why we always say it's important not just to engage patients and the public, but the providers as well, because they both need tools to bridge some of these gaps.
Very good, yeah. Now, a lot of my audience may not be familiar with this, but last year there was a little surge of ocular syphilis going on, syphilis of the eye, reported with some frequency, particularly out on the West Coast. It got to a point where the CDC actually issued an advisory for physicians to be on the lookout for it.
Right.
Can you talk anything about ocular syphilis?
Sure. Well, ocular syphilis is where the eye is affected, of course. Any part of the eye can be involved, but you often hear about uveitis, where the uvea, the middle portion of the eye, becomes inflamed, some pain and redness and that kind of thing. Ocular syphilis can develop at really any stage of the disease, including the early ones. It can damage eyesight and even cause blindness. And in that advisory you mentioned that CDC issued, they encourage clinicians to be aware of it, of ocular syphilis, and and to ask about ocular and vision issues in any patient who seems to be at elevated risk for syphilis, like MSM and HIV-infected persons, and really anyone who has risk factors.
Okay.
So absolutely, that gets back to reaching out to clinicians to make sure that they understand, so that they can engage their patients. Absolutely.
Right, and you brought up HIV, so that leads into my next question. There is a link between syphilis and HIV. Can you discuss that?
Sure, and in doing my research and taking some notes from this, it seems to me I ran across a stat that said in 2014 about half or so of MSM diagnosed with syphilis were also HIV positive. So there's a pretty clear link there. Okay, well, for one thing, infection with syphilis can cause sores on the genitals and elsewhere, like we talked about, and that's broken skin, those portals of entry, and it just simply makes it easier to acquire HIV. That's one thing. Another thing may just simply be behavioral. I mean, the behavior that puts you at risk for one STI probably is a risk for others. So HIV, STI co-infection is really not a stretch, and we see that with other things as well. It's not uncommon to see HIV and herpes co-infection, for example.
All right. The next topic I want to talk about is congenital syphilis, and you talked about that briefly. That's where the baby gets syphilis from the mother, and in the U.S., we've seen this rise, too, about 38% in recent years, which I think is pretty astounding in this day and age. Where is the breakdown in public health there?
Sure. CDC references, when they're talking about this, they reference a lot of missed opportunities in preventing transmission from mothers to newborn. For example, I read one of their reports where they note, that with the 458 cases in 2014, they said roughly about a fifth of those mothers had no prenatal care. And among those who did have care, many of them weren't tested for syphilis, even though guidelines call for routine syphilis testing at the first prenatal visit for all women. So there's a big missed opportunity. So that's something of a wake-up call, I think, around a lot of these perpetual issues. I just keep coming back to access to care, sure, but making sure that those who have it actually use it, and making sure their clinicians understand about syphilis, they're thinking about it, and that they're really up to speed on the current screening guidelines.
Yeah. All right, Fred, well, let me go ahead and close with this. I'll give you a chance to plug your organization. What is the American Sexual Health Association, and what do you guys do?
Well, we were founded 102 years ago now in New York. We were formed out of the early 20th century social reform movements who were fighting what back then of the day was called venereal disease, VD, which is now sort of evolved to sexually transmitted infections. We still work very heavily in STI education and outreach, and we've evolved ourselves over time to have a broader sexual health focus. Everything from policy issues to sexual functioning and pleasure across the lifespan, because these things really do quite overlap. Lately, a lot of our work has been around fostering communication, how to talk to your partner about sex and sexual health, how to talk to your healthcare provider, your kids, even your parents, As far as those healthcare providers go, we've got a section on our website just for them with toolkits and videos on how to have these conversations with their patients and things like that. So check us out at ashasexualhealth.org, and it's all there.
Excellent. I'll go ahead and put a link on the article I make after the podcast is available. And I want to thank you, Fred Wyand, and I hope you come on the show again to discuss other STIs as they come up. It was
delightful. Thanks so much for having me.
I appreciate it so much. Thank you, sir.